Assalamu alaikum. I am Dr. Farjana Khanam, Assistant Professor, Anatomy Department. Today our topic is the histology of cardiac muscle. Muscular tissue is the one of the basic tissue of the histology. Other the basic tissue are epithelial tissue, connective tissue and nervous tissue. In muscle tissue there are three types of muscle, that is skeletal muscle, cardiac muscle and smooth muscle. Today we will discuss about the cardiac muscle. This is one of the basic tissue. Its location is only heart and root of the great vessels, but the main location is the heart or the cardiac muscle. So, in this picture we say the shape of the cell. The cell of the cardiac muscle is called cardiomyocyte. The shape of the cell is short cylindrical and its important feature is the branching pattern. Branching pattern means it connect with one another by branching pattern, and in the branching there is the presence of intercalated disc. Now come to the nucleus. The number of nucleus in the cardiac muscle is usually single. It is due to its development and it is centrally located, pale staining. Number 3, the branching and joining of the adjacent cell by intercalated disc. We will discuss later about the intercalated disc. Number 4, it is cross-striated, that means which have the contraction power. The muscle is characterized by presence of striation and that will be the cross-striation. And the presence of unique feature of cardiac muscle, one and only the unique feature of the cardiac muscle is the intercalated disc. So, what are the feature we have told? The feature we have told that cardiac muscle is the short cylindrical with centrally placed usually single nucleus, sometimes double, and it is branching pattern joined with one another at some irregular or irregular interval. And other point, one and only the unique feature of the cardiac muscle, if anyone want to know what is the unique feature of cardiac muscle, that is the presence of intercalated disc, and as it the contraction power, so it should have the cross striation. Now cardiac myocyte, that is present in the myocardium of the heart. In heart we know it has three layers from inner to outer: endocardium, myocardium and pericardium. In myocardium usually we see the cardiac muscle that we discussed today. It consists of cross-striated muscle cell, cardiomyocyte, that is centrally placed nucleus. The nucleus is usually round or oval shape, centrally located. Cardiac myocytes are excited by conducting system of the heart, that means sinoatrial node, AV node, Purkinje phase and other fiber, and it acts as a physiological syncytium. After later we will know what is physiological syncytium. Cardiac muscle are usually innervated by autonomic nervous system, that is called sympathetic and parasympathetic. Sympathetic comes from thoracic second to fifth thoracic segment of the spinal cord, and it acts on heart to increase the heartbeat, force of contraction and dilate the coronary vessel. And parasympathetic comes through the vagus and it acts opposite of the sympathetic nervous system. Now during development the mesenchymal cells of the primitive heart tube align in an interdigitating process, so that the cells are branching, number 1. Number 2, these are branching so that it can act as a syncytium, so it needs the junctional complex, specialized junctional complex, that is called intercalated disc. Number 3, it has no stellate cells, so it is a permanent cell, that means if it is lost then no regeneration occur. Now today's our important topics is what is intercalated disc. This is a very important question, it is both for written and viva. Now we want to know what is intercalated disc and the location of the intercalated disc. As the cardiac muscle fiber are branching in patterns, so intercalated disc located at the irregular interval, and it is a cross-striation pattern or step-like pattern. It has a two region, transverse region and longitudinal region. In longitudinal region there are gap junction present. The gap junction communicate ion through all the fibers simultaneously, so it acts as a syncytium. Number 2, transverse region. Transverse region is very important. It has two parts. one component is junctional complex এর মধ্যে desmosome and other is fascia adherens. What is the desmosome? It is a junctional complex like in the epithelial tissue we have read about the junctional complex of desmosome. Desmosome attaches the fiber with one another by actin fiber and so that it inhibited or protect the fiber from separating during contraction. That means it act the fiber to continue with one another during contraction. So, when the contraction of the heart occurred, it acts as a force of contraction. That means it binds the fiber by intermediate filament. There is another junctional complex that is called fascia adherens. It is also present in transverse region. That means it bind the fiber into by actin filament. So, during contraction it acts as a contractile process. Now, in the summary of the intercalated disc, the location is irregular interval between the cardiac muscle fiber where one with joining with other by interdigitating phase. Number 2, what is the component of the intercalated disc? The component of the intercalated disc are desmosome, fascia adherens and gap junction. In summary, if we want to know the location of this junctional complex, then in transverse region only two component, that is fascia adherens and desmosome. In longitudinal region only one component, that is gap junction. So, in this picture we see the common feature of the cardiac muscle. So, we should remember that centrally placed nucleus, that is cross striation present, intercalated disc present. Now, come to another point, that is what is the covering of the fiber, that is endomysium. In endomysium, cardiac muscle reach of capillary, and in the perimysium, that is the connective tissue region which is thickened to form the cardiac skeleton. This is the picture, and this is the picture of the intercalated disc, cardiac muscle fiber and the nucleus. This is our topic. So, in summary of the histology of the cardiac muscle, we want to know, or at last we shall know, that is feature of cardiac muscle. In the feature, why the nucleus is single and what is the main feature, that is intercalated disc, and short note about the intercalated disc. Thank you very much.